is Well Women Today, and I'm speaking with Rebecca Lyons, Manager of Program Strategy for GoMo Health. She's here to talk about menopause in the workplace. Thanks for being here today, Rebecca.
Thanks for having me. I'm happy to be talking with you.
It's good to have you on. All right, let's get started. Please talk about your background and your work with GoMo Health.
Yeah, sure. So I actually studied developmental psychology as an undergrad, and then I went on to get a master's in public health. And after doing that, I started working all across the healthcare continuum for providers, for payers. Eventually, I landed at GoMo Health because through all of the work I did over so many years, I found that we were putting so much emphasis and stress on providers to have better outcomes for patients. And then I realized that the missing link and the thing I was most passionate about was empowering patients as an individual who could be their best advocate for their own healthcare. And so that was what I saw GoMo Health doing through empowerment, education, patient engagement. And so it was just a natural fit. I've been with GoMo for about 4 years, started as a project manager, and eventually started working on the program strategy side. So working with all of our clients to design programs to meet their needs, address their pain points, and ultimately ensure better health outcomes for participants.
Okay, so GoMo Health has a women, children, and families engagement hub. How does that address unique health needs of women throughout their lifespan?
Yeah, so we know that women are typically, and of course there are exceptions, but they're typically the primary caregivers for their family. They're the ones that are driving healthcare decisions. They're the ones scheduling appointments for themselves, their children, their husbands. And so we felt like there was a natural need to really focus on that population, women and children across the lifespan. So we've put a lot of emphasis recently on these programs that help women take care of their young children and their evolving needs, sometimes even including special needs that might come up because of chronic illness or developmental issues for children. We have a whole section that's part of the hub focusing on maternal and child health, what happens perinatally, postpartum. And then we are now also including more of an emphasis on women as caregivers, caring for elderly parents, caring for children, caring for spouses, caring for themselves in our, sort of midlife transformation program. And then we're thinking also about women as they're aging and how we can help them support that transition. Both in times of crisis, I'll say, when there is a healthcare need that is acute for themselves or their family members, but also just meeting them where they are, even when things are good, knowing that there's always an opportunity to improve wellness, to sleep better, to eat better, to have greater physical fitness, whatever that looks like.
That's very astute. So, was this a result of all the data you accumulated over time? Did you spot a trend, or was this something that the clients came to you and said, we'd like you to accumulate this data?
That's a great question. Well, we did, we've been doing a lot of work with employers
Hmm.
and thinking about what employers need to support their workforce. And so we did have a general program that we created for wellness for employers. And then sort of all the stars aligned. And as we start to see people are talking about menopause a whole lot more, it's like it's been the stigmatized taboo topic for so long. There hasn't been enough research. Women in general have not been researched, but especially the middle-aged woman and what she's going through as her hormones take like a giant dive, right?
Right.
And we're so excited because we've gotten to sort of join this movement that I think like we're sort of on the shoulders of giants, right? We have like the Mary Claire Havers of the world leading this new attention and focus on the gaps that have been around for so long, right? We have like something like 1.3 million women entering menopause every year, and 70% of them saying that they're not getting any support for the symptoms that they're experiencing. So I think all of those things sort of came together for us, and we felt like we really needed to double down on supporting women and in their quest for health and wellness for their families.
So recent research shows that unsupported menopause symptoms cost employers 1.8 billion, and you please correct me if I have this wrong, 1.8 billion in missed workdays annually. How do you see employee engagement programs like yours fitting into the solution?
Yeah, it's a great question. I think that we can be one of the forces of change. There has to be a big change. I think, think about how, and by the way, that 1.8 million is correct and jives with what I've seen. I believe it's that number, that figure was due to a survey that found that 11% of women have in the perimenopause and menopause phase of their life are missing work due to symptoms that have gone untreated. So I think where we see our biggest opportunity is to help with education, engagement, and empowerment. And I think especially for these women in the workplace to know that just like when you go through the transition of having a baby, and I think as a society, we're a little bit more supportive of new moms, right? We've created policies and at the state level, sometimes maybe even federally, to support lactation and breaks for lactation. And we've given people maternity leave. And we've thought a lot about what they need to take care of themselves, but maybe even more to take care of their baby. And I think this is an opportunity for us as a society to think about how we take care of the person who's been taking care of it all and holding it together for all of us, for all of our families. Um, and I think it's just a super exciting time. We can help fill the gap, both for employees and for employers, to just start the discussion and reduce the stigma. Maybe it looks like what we can offer is this very stigma reducing technology, which is a very personal conversation over the phone via text, which gives snackable bites of information. We can provide resources and education to these women in a way that helps them advocate for themselves, both when they go to a provider, not get gaslit about symptoms that they may or may not be having, but also advocating for themselves in the workplace. And maybe it looks like saying to your employer, I need to have a changed schedule for work because I know I need to have an hour of a nap time in the middle of the day because I'm not sleeping well at night because my hormones are out of whack. And maybe it looks like having a discussion with a provider about what you really are experiencing and how to address those needs.
How do you get women comfortable even talking about that? Because first of all, kudos because many of these women are part of the sandwich generation where they're taking care of children and they're taking care of aging parents. But also, um, women have been taught that they have to sort of keep up with men and not talk about these things and not give the appearance of being weak or not able to rise to the occasion. So how does GoMo help to normalize it? How do you get women to
Yeah.
talk about these things?
That's a good question. So part of what we built into our program, again, I don't know, your guess is as good as mine. This is just my idealistic hope that we can move the needle a little bit. But
Okay.
part of what we built into our program is an online community. And so we love this idea that right now more than ever, I have this vision of women banding together and feeling comfortable advocating for themselves. Um, for example, I'm going to give you like a real life example. I found out recently that women need, on average, 20 minutes more sleep than their male counterpart. And do you think that actually happens? Like, think about every woman that you
No, I
know,
don't think so.
right? How many nights have I been awake on my phone, signing my child up for soccer, texting my parents who are, aging, making sure they don't need a ride to their doctor's appointment, finishing that last email because I'm also working and also preparing goodie bags for my son's birthday party. And I look over at my snoring husband who's been sleeping an hour longer than I have. And I think, and I say that not to male bash, but I think that a lot of us are in that position. Every one of my friends, we joke about how our husbands have the good life and we're working our asses off. So I think we owe it to ourselves to like maybe this transition, this time maybe it's our opportunity if we can actually reclaim it to put ourselves back on the list, take care of ourselves, go make the doctor's appointments for ourselves, find and seek out the information. And that's where GoMo comes in, is instead of putting these women who are already exhausted and burnt out on the, making them suffer on their own, we're trying to like kind of hand feed a little bit, like here's the link that you can go to learn more about how to improve your sleep. We did the research for you, click here, right? So if we can just sort of support them, women are smart, and by the time we reach our 40s and 50s, I think that we know what we need, right? And we, if we just have a little bit of help, we can advocate for ourselves quite well.
So I agree with you there. I think advocating is fine and effective, but how do you get the employer buy-in? Because most of the employers are males, and how do you get them to sign on and say, "Oh yes, I recognize that
100%. Yeah. I
my
mean, I
female
think
counterpart has
unfortunately,
different needs."
yeah, it has to be, it's not enough to say, oh, you care about these people. They've been doing great work for you. Let's take care of them. It's more about the bottom line. And so if we can show them the figures and say, look, you're losing X amount of dollars because of absenteeism, which we know is caused by these unaddressed symptoms. You're losing X amount of, the dollars will tie to those markers that we can show. We also know that 10% of the women leave the workforce during their perimenopause and menopause years because of these symptoms that they can't get resolved. And that's a huge loss for employers because they have these people at the sort of the peak of their career with all of this great experience, and then they're leaving. So I think if we can impress upon employers that it's for their bottom line, especially self-funded employers, when they're also paying, the risk for all of the healthcare dollars that they're spending is on them. We
Mhm.
can show them that by addressing these symptoms early, we're going to reduce these negative downward trends that we would see. Because when you see that a woman's not sleeping, you just give her some hormones and fix the sleep. She's not going to have this negative cascade of a mood disorder that's going to happen in the next year that's going to take her out of work for a couple of months.
GoMo Health emphasizes brain health as fundamental to well-being. How does this focus specifically benefit women experiencing menopause symptoms that you
Yeah.
just talked about, the brain fog and memory challenges?
Yeah, exactly. Well, we're so excited because we partnered with the Center for Brain Health in Dallas, Texas. They are like the leading group for research on brain health overall, but they're also really doubling down on focusing on women being different from men, right? So much research has been done on men only, expecting that women are just tiny men. And they really fundamentally understand that what we go through with our hormones is incredibly different than what men go through. So they have helped us with providing great content. And then we've paired that with our behavioral RX technology, which really has allowed us to support women from the standpoint that you talked about, right? All of these changes that can happen in this midlife transition, brain fog, problems with cognition, memory struggles, sleep. Sleep is so important. We've talked about that already, but really understanding the importance of sleep and how it helps to regulate all of the other functions that our body so depends on for wellness.
So walk me through how your personalized real-time support would work for an employee experience. So I'm an employee. I'm experiencing menopause symptoms. I'm experiencing hot flashes, even though the office is freezing cold. I'm burning up. I can't focus. I'm drenched through my blazer, and I can't seem to wrap my mind around my schedule. I've got all of these issues going on and I need support. How does GoMo help?
Yeah, great question. So we have a couple of ways. So for one, we do have the ability to send messages over SMS, like I mentioned, and those would be really sort of triggered by our own system. However, we also have the ability for you as the participant to get real-time support. You can text in, for example, hot flash to a code 43386. You text the word hot flash and you can get real-time support. A message will come right back to you that will say, hey, Alyssa, we're so sorry to hear you're having a hot flash. Have you tried this? And you can click a link, and there might be, this is a terrible example because for a hot flash, I don't know if that would actually help, but maybe it would be like, read what other women have said on our online community portal about their hot flashes. And you could click the link, and maybe you take a break, you leave your office for a minute, you tell your boss you're not feeling well, you need a second, and you go and you can read what three other women said about their hot flash. And maybe it makes you laugh and maybe you feel a little bit supported. We also have the ability to have online libraries of resources for you. So we would that would all be tailored and personalized to the things that you've let us know you're struggling with, and you in that moment could go into your library of resources and click on the hot flash document that says like this is what you should do during a hot flash, and it's all just on your iPhone right there for you. But I think over time too, we have the ability, we have a dashboard that we've created so you can go in and log your hot flash, and then the next day when you have another one you'll log that too, and when you go make an appointment with your provider you can show them on your phone, these are I had 5 hot flashes in the course of 2 days, I'm really struggling. And that's another opportunity that we have to arm you with what you need to go advocate for yourself with your provider.
Do you recommend breaks during the day? You mentioned breaks. Do you mention to employers that menopausal employees may need more breaks?
So I think the intent is that as we bring these programs to employers, it's changing the culture, it's changing the awareness. Oh, we have these women who are going through drastic hormonal changes in their body. Yeah, I think that of course, listen, we can in our messaging we talk about specifically getting the breaks that you need, getting the sunlight that you need, if and when you can, advocating for a different work schedule that works for you. I personally, a couple years ago, I decided it wasn't good for me to work 5 days a week. A lot of other countries have like actually come around to that. The 4-day work week is really gaining popularity. I would just personally implore women to advocate for what they need more. If that looks like a creative schedule where they know they do their best work between the hours of 6 and 8 p.m., because some people might, and they really might need that hour in the 2 hours in the middle of the day to take a siesta because they're not sleeping well at night. I think there's an opportunity. And what we've done through our program is educate people about circadian rhythms, about the importance of morning daylight, evening daylight, and how that helps regulate their sleep. And so the intent is with the education and then maybe the nudge of advocacy and having employers that are signing on to this, right? They are making a financial commitment to offer these programs to their employees. The hope is that they will also start to honor the requests about changing the structure.
Hmm. I'm just trying to see how that would square in an office setting where the male employees don't feel cheated. Do you see what I'm saying? Where they feel like, well, you're giving the female employees special privileges. I'm going through changes also. I'm also middle-aged. Why can't I get more breaks? Why can't I? I mean, have you ever seen that scenario?
Well, I mean, listen, personally, I'm the wrong person to ask because I would say, great, everyone should work in the way that works for them. I don't think I think that our corporate culture in this country is slow to move, but I think the pandemic was helpful and instructive. I think people started to see that you could give people a lot more freedom. They could work from home. They didn't have to have a 3-hour commute each day.
Right.
And when we started to take care of people a little bit more, and honor the fact that everyone should be exercising. And if that means they need to fit it in and take a 10:30 yoga class and then skip a lunch break, which traditionally most people had like the 1 hour lunch break, but maybe that's okay. Maybe it's not a bad thing if our male counterparts see us taking care of ourselves. We're always the trailblazers anyway. And maybe it's better for them. Maybe they're going to be healthier if they take a 1 hour walking break every day instead of drinking beer at 5 o'clock. I don't know. Not to stigmatize men for drinking for alcoholism, but
I saw a mention on your site of a partnership with the Center for Brain Health. So, how does this evidence-based approach differentiate your menopause support from other workplace wellness programs?
yeah, so we're just including the learnings that we've gotten from their extensive research, and pairing that with our behavioral RX technology. We have a close relationship with them. They've provided a lot of content that's all evidence based on the extensive research they do. They are the trailblazers when it comes to reducing brain fog, understanding the importance of brain breaks, understanding the importance of sunlight, sleep. A lot of great content around mindfulness and meditation and mind body practices that we really see in the research can support all brains, but especially brains going through these drastic hormone changes.
So just so that I understand, again, I'm an employee and I work at Acme Company, and this company offers GoMo Health support. So how would I access that? Is that something that is there an announcement made, or do I suddenly get a SMS alert? Like how would I be made aware of that?
Great question. It really is up to the employer that we work with. So some people might give us a file that has all of their employee roster with their mobile number and their email, and they can actually, we can engage over email or over text. So they might say to us, go ahead, we do have consent from all of our employees that we can send them messages. And so we might send a blast message to each one of those employees, like, hi, Alyssa, as an employee of blank company, you are entitled to join this employee wellness program. Press 1 if you're interested, text 2 if you're not. And if she texts 1, then we can send her a brief little form that she needs to fill out so we can get the information we need to make sure we enroll her into the right components of the program. Another way to do it might be, so that would be like a more passive enrollment where we're kind of, but with an element of someone needing to opt in. We
Mhm.
could also just opt everybody in and start sending them messages, of course, and then tell them if you want to opt out, we teach them how to do that. Another way to do it would be very much more relying on the person selecting into the program. So we could create a QR code and have it up in all the break rooms that says like, to join a free program that is provided by your employer, capture this QR code, and then when they do that, they would be able to enter into the program that way. Does that answer your
Hmm.
question?
Yeah, it does. It does. So if I'm a male employee, obviously it's not going to point me towards the menopause support, right?
No, but good question. We do have, general wellness at work programs as well. And the menopause program might be part of what is offered through that program. And so it could be generic, depending on what was purchased by the client, we might be able to offer it to everybody. Now, if we wanted to make it, if a client only purchased the menopause program with us, then we would just say like, hey, women, and frankly, you bring up a really good point that we don't need to exclude men. We also could say like, hey, if you have a mom, you have a sister, you have a wife, you might have a daughter, then all of, if you want to join this program too, you could learn about what your what your female friends are going through. And that's something, that we could even think about adding is almost like a male support track, but I don't see any reason why we would need to exclude men. Now, usually though, there will be an overall general wellness program and they will purchase the additional menopause program. And when somebody captures the QR code, or if we have a roster from the employer, then we know who's male, we know who's female, we know who to enroll into which program. And we can
Okay.
capture fields like age, for example. So if we have date of birth, we are not going to necessarily put a 21-year-old woman into our menopause program. She might be more interested actually in a preconception program if she knows she wants to get pregnant. And those are all things that we can flesh out both with the data that we would get from the employer or the payer or the provider, whoever's using our services. And if and when we're missing something that would come in on a file, we can always glean that information from the participant themselves.
Oh, okay. So do you have like a mini pre-screen depending on who?
A
So you
hundred, yeah,
okay.
yeah, that's a really good way to say that. Yeah. And we design those with our clients, right? So for
Oh, nice.
example, some would be longer than others. And sometimes we want to know really detailed, specific information. For example, you know, we have a couple of programs that offer support for substance use disorder. And so we can add some very specific questions, not just like, do you want to get information about substance use disorder, but we can ask some validated instruments like the 5 Ps, if you're familiar with that, that would ask questions about people using substances, you know, people who you're close with who use, which puts you at higher risk, whether, regardless of whether or not you're personally acutely suffering with SUD. We have the ability to see who might be at risk, and then we can start to message them directly.
So how do you envision workplace menopause support evolving, and where does GoMo Health fit into that future?
So I might be idealistic, but I really believe that GoMo can help sort of join forces with what I really see happening in the larger culture, which is advocacy and awareness and empowerment among women. And I really hope and believe that as we as a society do better about researching both women, but also women in this time of their lives, because we've been so bad at it up until now. I do see people really pioneering and changing that in the moment. Um, but GOMO's role is really about engagement, empowerment, and education. And so if we can sort of support what's also happening in the world around us and in a more sort of acute and direct way with women, then I believe that they will be better armed to to make some changes. And I just in the same way that women have created a world for themselves in which, and it's not perfect, there's room for improvement, but when they come back to work after having a baby, we do make accommodations for them to have lactation rooms available. And maybe that's just in the state of California. I'm very privileged living here. I know I haven't done my research on what it's like in other states. But I know that there are very detailed laws that support what women need after having a child, at least in this state. And I hope that we could get there for women in that middle age transition so that it can be make your own schedule, take the naps that you need, get the fitness that you need, because we know that when women are healthier, they are better employees, they're better moms, they're better spouses, and it's just better for our society.
Hmm. You know what? I am feeling optimistic and idealistic right along with you. And I envision that future. I'm mind melding with you and envisioning that future in every workplace.
No, I know it's idealistic, but I see things changing and I feel it happening all around me. So I think we'll get there.
I really hope so because, a lot of women, get put out to pasture and that like literally their best years, you know.
Yeah.
Yeah. So it would be
Yes.
nice to see this happen. Thank you.
Thank you. It was great talking with you.